Hi, welcome to the series of solving MCQs for NEET PG. So this is a recall question from NEET PG 2024. Here a very expected question was asked, that is on renal tubular acidosis. RTA is one such important topic that you should never miss. So before moving into the question, I want you to look at this table. This is a very important table and the only table you need to remember. First of all, you have to remember one thing, that if they give a potassium value more than 5.5, that is on higher side, then straight away mark the option as type 4 RTA. Other than that, they could give history of CKD and also diabetic patient, hypertension. Okay, so in such a scenario, you should mark answer as type 4 RTA. Now, differentiating type 1 from type 2 RTA, first of all, I want you to remember that students often make this mistake, that even though they know that the answer is type 1 RTA, but in option, if they mention that it is distal RTA or proximal RTA, we often tend to mark in the stress of exam as proximal RTA. So don't do this silly mistake. Okay. Now moving ahead, how to differentiate type 1 and type 2 RTA. First of all, if they give in history that the patient is of Sjogren's syndrome, or if patient is on amphotericin B off, or if the patient has history of renal stones, then the answer could be type 1 RTA. On other hand, if they mention that the patient is of Fanconi syndrome, then the answer could be type 2 RTA. Okay, if they don't mention any of such history and they give lab values, we have to look for two things. First of all, look for the urinary pH. If the pH is on higher side, then it is type 1 RTA. If it is on lower side, then it is type 2 RTA. Okay, and another thing is citrate level. Citrate level are low in type 1 RTA, that's why there is stone formation, while in type 2 RTA the urinary citrate levels are high, and this urinary citrate is one that prevents formation of stones in such cases. Okay, so if there is a history that potassium is low and pH is also low, less than 5.5, then it is type 2 RTA, while it is, if it is more than 5.5, then it is type 1 RTA. Now moving ahead to the question again. In this, they gave the lab values and they asked for the diagnosis. First of all, the potassium was low, then straightforward type 4 RTA is not the answer. Okay, now look at the pH, it is more than 5.5, then the answer here could be type 1 RTA. Okay, happy learning.